is intermediate hyperglycemia similar to prediabetes?
No. So intermediate hyperglycemia is a condition which we can diagnose with 1 hour. Now this is a new term, which is intermediate hyperglycemia, which you can get after 1 hour. But they are at the higher risk of developing diabetes. To the same amount of the carb which is taken by Caucasians and Indian, the post-meal glucose will be higher. Who are otherwise not diagnosed diabetes, not diagnosed pre-diabetes, but still you can diagnose them with the intermediate hyperglycemia and they are at the risk of developing diabetes. It means you can prevent them to becoming diabetes.
Sir, I would like to ask, what is the position statement of IDF regarding 1 hour postload plasma glucose for diagnosis of intermediate hyperglycemia in type 2 diabetes mellitus?
Thank you, Vikranti, for this very important question which you are asking. But before I answer, I would like to thank D-Genius Group, which is a group of young diabetologists who are working across the country and they are part of Diabetes India. As a past president of RSSDI and currently I am the chair elect for International Diabetic Federation of Southeast Asia. This position statement which is done by IDF and then there was a paper from RSSDI which we have published in our journal. This position statement which is very important, that it is more important for Asian and Indian, which is talking about the 1 hour post-load plasma glucose. It is not like that it is something new. It was there because when you do 2 hour post-glucose value, some of their patients where fasting is normal, you give them 75 gram glucose overload and their post-meal glucose is also normal. But it is 1 hour in between. If you take one more sample of that, you will find that some of them have a hyperglycemia and that what we call is a intermediate hyperglycemia. I'll be discussing more about it once you talk to me more about this intermediate hyperglycemia. But this intermediate hyperglycemia more than 155 milligram post 1 hour after giving them 75 gram of glucose is a very important marker and on which International Diabetic Federation had come out with a position statement with a consensus of more than 30 experts from all over the world, and they have written a paper, and on that paper we have written one more paper from our RSSDI board and which we have published in our journal.
So, is intermediate hyperglycemia similar to prediabetes?
No. So, intermediate hyperglycemia is a condition which we can diagnose with 1 hour. While you know that a post 2 hour hyperglycemia, which means more than 140 but less than 200, we call them pre-diabetes. Or you get it by A1C, that A1C report of not more than 6.5, it is less than 6.5 and more than 5.7 rate. That particular condition we call is a pre-diabetes. You also know there is a condition pre-diabetes can be divided into impaired fasting hyperglycemia and there is a impaired glucose tolerance, IGT. Now this is a new term, which is intermediate hyperglycemia, which you can get after 1 hour. But they are at the higher risk of developing diabetes. If you follow these people, they are at the higher risk of developing diabetes. It means we get an opportunity for these people for preventing them to become full-fledged diabetic. So this diagnosis of intermediate hyperglycemia, if you are doing with a 75 gram glucose, OGTT, it's better to have 1 hour sample also.
Why is the 1 hour oral glucose tolerance test value particularly relevant to Indian population?
So you know that in compared to Caucasians, the Indians have more postprandial hyperglycemia peak. Even we have more carbs intake also. If you see or compare the Caucasian versus Indian, our gut response to the same amount of the carb which is taken by Caucasians and Indian, the post-meal glucose will be higher. So that's the reason this 1 hour OGTT value is more relevant for India. It means you will able to diagnose many people who are otherwise not diagnosed diabetes, not diagnosed pre-diabetes, but still you can diagnose them with the intermediate hyperglycemia and they are at the risk of developing diabetes. It means you can prevent them to becoming diabetes if you are doing OGTT.
I would like to ask, what are the advantages of using 1 hour value in OGTT?
So one The OGTT, overall now people are not doing many. It's not very commonly done test because it is to be done in a primary care physician level. Now after getting the A1C, which we are normally doing for those people who are at the risk or those who are going for a health checkup also. But still, if you can get it 1 hour OGTT, giving them 75 gram glucose, checking their 2 sugar value instead of 1 hour and 2 hour both, and you can diagnose many of them for getting intermediate hyperglycemia. In my clinical practice, I do both the things. If I find that patient HbA1c is not exactly at pre-diabetes but still at a higher normal, the other thing which you can do by putting them on a continuous glucose monitoring, even that can also give them that what happens to 1 hour too. But ideal one is to do their 1 hour post OGTT value. That will give you an idea that they are the person who are at the intermediate hyperglycemia. It gives you opportunity for them to discuss, to talk to them, to teach them, educate them for their lifestyle modification, and it will also help us for prevention of diabetes for these people.
So, sir, recently you have talked about CGM. So, how do you see the role of CGM in conjunction with OGTT in assessing glucose tolerance, especially at 1 hour peak?
So continuous glucose monitoring, it's a technology and it is giving an advantage of continuously monitoring the sugar. And now we have seen that many of our non-diabetic people, for their awareness in the health, they also use continuous glucose monitoring, and you can find that they are not doing 1 hour OGTT, but still you can find their after meal what happens to their sugar. And you will find that some of them have intermediate hyperglycemia. You can also find them that after eating more carbs, either in lunch, breakfast or sometime in snacks, their sugar goes up. And this can be correlated because they are having intermediate hyperglycemia, even their A1C is actually non-diabetic range, and they have high risk of developing diabetes. There is some paper also which is published recently, even in ETTD also, a few papers were there who are non-diabetic. So the role of continuous glucose monitoring is increasing in people to diagnose them for diabetes, for IGT and for intermediate hyperglycemia. The healthy people who are using it, they are also getting the advantage of knowing that what happens to their sugar value after eating different varieties of food and how they can change their lifestyle to improve as far as glucose which is increasing post meal, and how they can change their diet pattern which can help them to prevent the diabetes. So the CGM role is increasing not only for therapy, for adjusting the medicine what we do and lifestyle, but it also helps in the people who are completely not diabetic, and still we can diagnose them with doing the CGM.
So thank you so much, Dr. Banshi sir, for joining us today on our podcast. Your insights on the post-load plasma glucose 1 hourly was truly invaluable, and I am very sure that our listeners and our fellow doctors will take away a lot from our conversation today. We really appreciate your time and expertise. So until next time.
Thank you.
Thank you so much, sir.
So thanks Dr. Vikranti, and thanks D-Genius from Diabetes India for giving me this opportunity and for making podcast. Thank you.